Endometrial cancer, also known as uterine cancer, is cancer of the lining of the uterus, where the tissue that sheds during your normal menstrual cycle comes from, or where during pregnancy a baby grows. So endometriosis is not related to endometrial cancer. It is growth of the lining of the uterus outside of the uterus that can cause scarring and pelvic pain. So it's very different than endometrial cancer, which is a true cancer. Endometrial cancer is diagnosed on a biopsy. Unfortunately, unlike breast cancer with mammograms or cervical cancer with pap smears, we don't have a screening test for endometrial cancer. So seeing your OBGYN provider regularly and talking about your bleeding or symptoms is very important. Symptoms of endometrial cancer can start very, very subtly. So for women who have already gone through menopause, irregular spotting or even pink or brown discharge, or more intense vaginal bleeding that's like a period if you've already gone through menopause. That can be concerning for endometrial cancer. For women who have not yet gone through menopause, heavy menstrual bleeding, bleeding between your periods, having periods that come too frequently can be a sign of endometrial cancer. Luckily, these are usually caused by benign conditions such as a polyp or fibroids, but this just highlights the importance of seeing your OBGYN provider on a regular basis. Endometrial cancer is most frequently diagnosed at an early stage, and luckily we can treat this with surgery. So we'll do a hysterectomy, which is removal of the uterus, cervix, fallopian tubes, and most of the times the ovaries as well, and a sampling of lymph nodes. This can be done in a minimally invasive fashion through small incisions using traditional laparoscopy or robotic surgery, and for many women, they can go home same day. Many women don't need any treatments after their surgery, but need to be closely monitored. But for some women who need treatment after a hysterectomy or are diagnosed at a later stage, we use a combination of chemotherapy, immunotherapy, and radiation to treat endometrial cancer. Thankfully, we've had great breakthroughs in endometrial cancer research in recent years, and this means that we've had better outcomes for our patients.